Okay, so just a little video about rotator cuff, because I know a few people who are getting issues with this. So the rotator cuff is a group of muscles in your shoulder. Basically, if you think about the bony spine of the scapula, the shoulder blade here, there's a muscle called the supraspinatus which sits in there, muscle infraspinatus there with teres minor below it, and then on this side of the shoulder blade in here you've got the subscapularis muscle. So they should hold your upper arm bone, your humerus, in place so that it can smoothly move through all of that. Hello Crocky, she loves to get in the videos. So if they're working well, yeah, you should be able to move without pain. But if they're not working well, particularly if they're torn, then you're going to get pain even on this kind of movement or anything coming out to the sides like this. You might find that there's a bit of hiking, awkward movement to the shoulder, and you get pain in here from impingement. So we need to get them working properly. Now the other thing to remember with that before we go on to the rotator cuff exercise is that the shoulder blades themselves are the anchor point for these muscles. So if the shoulder blades are not being controlled very well, then these muscles that are pulling off of them are not going to have much purchase at all. So first and foremost, you need to get good control of the shoulder blade muscles, which means having the strength to easily pull them in together and down. So it's that kind of movement there. They need to have that kind of base. And as you're coming up above your head with the movement, they will naturally move out and rotate. But for a lot of people, they're doing that way too early. So that movement's already happening with the shoulder blade, their shoulders hiking up to here before they even try and move the arm up. So especially if you've only just damaged the rotator cuff muscles, they're going to be probably too sore and not knitted together enough yet to be able to do any kind of major strengthening with them. So first thing you want to do is work on those shoulder blades coming in together. So something like a Brugger posture relief exercise. So I'll just back up to this so you can see it from standing. I'll just drop down to here so you can see better. You don't have to do the leg split, I'm just doing it to fit in the camera. So you want to stick the chest out, squeeze those shoulder blades in and together so like you're pulling them down towards your butt, and then just turn your arms out like that. If I show you from the side, you're just tucking the chin in as well, in there, okay? And so you hold that position 5 to 10 seconds and then release. 5 to 10 seconds and then release. One of the other things that you might get from physio, etc., is something like these bands, and if I get to the right height, they'll just ask you to kind of pull apart and stretch the band like that. If you actually do that if I can get the right height for this, if you actually do that, I mean you would do this kneeling down, but I'm not going to mess about with the camera here. You just want to get your back nice and flat in that kind of prayer stretch, child's pose in yoga type position, with your band like that, elbows touching against your sides, and you're just going to try and pull apart a little bit like that. And what that will do with the shoulder blades is it will flatten them against your back here. And so you're just trying to practice holding that position. Obviously again, if your rotator cuff is too sore, you might find that the band is too much resistance to that, particularly if it's a stronger band, or if you try and really pull it apart. So if you just want to just set that position, then that might be all you can do to begin with until it starts to improve. Obviously then, as it is improvement, you can go with stronger bands and more movement in there. So you'll see the classic kind of rotator cuff exercises that they give out like this. But again, it's really important that you've got those shoulder blades back in that position. It's not going to be as useful if you're doing it like this. Obviously I'm exaggerating on the position, but you really should get used to getting the shoulder blades in the right position. Then from there, there's another exercise that I really like, which I don't see given out too often. You need a mirror, ideally. Obviously, I'm looking at the camera now, so I'm going to use that as my mirror. So arms down by your sides like this, elbows bent. So I call it a chicken wings exercise. And what you're trying to do is to raise the elbows up, trying to get up to at least 90 degrees without the shoulder blades coming up, without that lift up there. So you've really got to fight to keep those shoulders in and down, using those muscles between the shoulder blades, the rhomboids, the levator scapula underneath here as well. Really trying to keep those down all the way through, so I can feel this contraction in under here as I hold those down. And you see my shoulders staying down, left one's rising a little bit. Okay, so what we don't want is to have this immediate lift and then movement. Okay, we're trying to get away from that. So if you start doing it and they come up, stop, come back down, reset, focus on trying to keep that hold, and see, you might only be able to get to there to begin with. It might take you weeks to actually build up the ability to hold it until you can get up to 90 degrees. Okay, obviously beyond there you're going to have to start lifting the shoulder blades anyway, and that's fine, that's normal. They should start to lift at that point. You just want to be able to get up to that point with the rotator cuff applying the right control on that. And then the other things that people will start to move on to from there, sometimes they might get like you might be told to get a ball and roll it around the wall. Again, those things are fine further down the road, but you have to have that shoulder blade control before you really start doing those. So I'm just talking about this basic stage, the sort of things you can do while it's still reasonably painful in there. Although obviously if you're getting sharp pains that really make you feel weak in there, then the muscle hasn't knitted together properly yet. So you've got to be really limited on the resistance you put to it. You do want to make sure that it's going through some range of motion though, even if it just involves you doing some kind of passive stretching or laying on your back and just getting a bit of rotation in there, because if you don't move it, then it's really going to stiffen up and you run the risk of something like frozen shoulder. So movement is key, but obviously that sharp pain that feels like it's got weakness with it, like the muscle might be rapidly overstretching, well, essentially that is what's happening if you're getting that feeling, and it needs to actually have a bit more time to knit together before you really push it. In terms of how much should you push these sort of things, I mean, it's how long's a bit of string really. To begin with, I probably wouldn't go much more than about 2 to 3 sets of 10 a day, and see how it feels the next day. If it feels like it can go again, then give it a little bit more, but just keep an eye on it over this first week or two, and then obviously you can expand it beyond that up to sets of 20, maybe even 30, or just do more sets. Or if you start adding in more resistance, once you add in a fairly high level of resistance, I would start having at least 1 day of rest in between, because then you can eventually get onto, if I bring my band here, I've got it attached to the wall there, from that position, you know, you can do these kind of things where you're doing your outwards rotations, and again, if you're going to do this sort of thing, start off with the elbow by the side, make sure you've got the shoulder blade holding in tight, and then you would come out, I'm going to change the angle slightly, you would come out to here, so you've taken the elbow a little bit further away, and then you're going to do that from there, but again holding that shoulder blade really tight. Now this is really going to, the further away you go in doing all this kind of stuff, you're really talking kind of sports rehab at this stage. You know, for anybody not looking to get a super strong throwing shoulder, you know, just getting to the level where you can do that well, and that one, you know, with the band, and then these ones with the little turns on the side, and doing some stretches to loosen up the things like the pecs, the lats, if you're doing, you know, the overhead stuff laying back, then that's going to be enough for most people. But again, it could take several weeks. You might be able to do it in maybe 3 to 4 weeks if you're a quick healer and you get everything right pace, but rotator cuff, it can take a long time. They're not the quickest of muscles to heal, so you could be talking, you know, months even. But you know, keep plugging away at it. You will get there eventually if you stick with it. I did mention some of these things like tight pecs, tight lats. Obviously you can look up stretches for those if you want. I'm not going to go into them in this video, and obviously the quickest way to get any of those things looser, so you have got that range of motion, it makes it easier to work the rotator cuff and to deal with some of the pain and boost the healing of the rotator cuff, is to get some treatment on it as well. So a masseur who knows what they're doing, you know, chiro, osteopath, naturopath, physio, you know, anyone who's qualified to get in there and do the appropriate soft tissue techniques on those muscles. And of course you can also you see someone like acupuncture for pain relief as well. All right.